Thank you, Shelby. I need an extra brain, always. So you are here for our monthly CoC training, and today it's going to be about trauma-informed care. And if you don't know what that is, you're going to find out. Just a few reminders. So we're asking folks to all be muted while the presentation is happening. There will be opportunities for you to ask questions. So you can either put questions in the chat or you can raise your little virtual hand, and then the trainers will call on you or respond in the chat. We will follow up with an email afterwards that has a link. So this is being recorded. We're going to send out a link to the recording as well as the materials. And we're going to do a quick who's in the room quiz in just a minute. I'll do that in just a second. Oops, that is not what I meant to do. Sorry, everybody. I have 3 screens open and it's acting weird. Okay, we're going to do this quick poll real quickly just to see who's in the room. So you can answer, and these are all anonymous. We just do these polls so that we can track and see how well are the folks that are coming to these trainings representing the population that we're serving. So we ask a question about race and ethnicity. You can choose all that apply. We're asking if folks have experienced homelessness themselves, what best describes the kind of agency that you work for, or if you don't work for an agency, you can tell us that, and then what best describes your role. And so this is going to help us and the trainers kind of have a sense of who's here. So we'll just give that a second. Okay, we're going to just do a few more minutes on the poll. Okay, about half of you have responded. Great. There we go. A bunch more have just come in. And then I'll share the results out in a minute. Oh, but they're still rolling in. Okay. All right. Okay, I'm going to end it in just a minute. Actually, you know what? I think we can let this continue to roll. Is it blocking your whole screen? Okay, great. So we'll just let that keep rolling and then we'll go back and look at it in a minute. Okay, let me go back to the rest of my slides. All right. So we talked about housekeeping. The other thing, just some training norms and agreements that we have in our community. So these are pretty basic, but respect the trainer, respect the attendees. And the last 3, make space and take space, share the mic, and acknowledging power and privilege is really just about being mindful of what you're coming into this training with in terms of personality, in terms of things like power and privilege. This could be class, race, ethnicity, gender, all of those things. Just be mindful about how much space you're taking up and or push yourself to take up a little more space if that's not usually what you do. Just a quick note about our training. So we do these monthly. They are targeted for homeless service providers, but they're actually open to anybody that's interested in these topics. We generally host them the second Monday of every month. They are required for direct service staff and program managers for CoC providers, but they are open to all. Some of these trainings are required. The Department of Housing and Urban Development is kind of our largest funder until recently. We'll see what happens, but many of these trainings are required because they're going to provide essential skills and information for how to provide homeless services in really evidence-based ways. Others are things that we've decided as a community are important. So the goals of this training, and you'll hear a lot more from Ari and Maya, but really just understanding at a basic level what it means to be, as a provider, to be trauma-informed, explore the impact of trauma, both from a client and a service provider perspective. So a lot of us come into our work with histories of trauma that may come up as we're doing this work, and also understanding how to respond when somebody else is having a trauma response. And then understanding key principles of trauma-informed care, including the role of cultural humility. And if you don't know what that term is, you're going to learn, and how to use that in your daily work. And then this is just like notes in terms of like in our own written standards, why we think this is important and the things that we want people to come away with. Shelby, I don't know if you want to add anything here about monitoring. I'm happy to talk if you're
Good morning, everybody. Just a reminder that these trainings, like Jamie mentioned, are required for our homeless service providers who are direct service staff. So please make sure you're sending your staff, and we always talk about it during our quarterly meetings. If you have any questions, feel free to reach out to me. Thanks.
great. And with that, I'm going to end the poll, and I want to share the results with folks. Okay. So there's the results. So you can see in terms of race, ethnicity, it's a good mix. 20% of us have a lived experience of homelessness. And then you can see, especially for trainers, hopefully you can see about 88% of folks here provide services to people experiencing homelessness. And we have a mix of housing navigators, case managers, mobile outreach, and others. So I'm going to stop sharing. And with that, I'm going to turn things over to you two.
Excellent. Thank you, Jamie. Good morning, everyone. So my name is Ariana Saunders, or you can call me Ari. I am an associate director with the Training Center at CSH, and I'll give a quick spiel about what CSH is and the Training Center is in a second. But really excited to join you all today to talk about this trauma-informed approaches and what it means to be trauma-informed in the work that you do and serving folks. And it's awesome to see that you have so many diverse kind of experiences and roles right now coming to this table, because one thing that I just love to remind folks too is we like to say trauma-informed approaches too. We'll interchange that with trauma-informed care, but it's intentional about approaches to include approaches in our language and our training here, because anybody can do this, right? This isn't about being a clinician or having to have any kind of special certification. It's really about a lot of what we're going to talk you all through today, which is once we have a kind of a basic understanding of what trauma is and how it may show up in folks, and just the simple fact that it's going to look different in everybody, the more equipped we can be to really make sure folks feel safe and feel supported in the work that we're doing by recognizing those signs and being able to adjust our approaches, adjust our work, and hopefully even find the ways to adjust our services and support that we offer folks so it's meaningful to them and it's helping them in their overall kind of journey towards recovery and resiliency, as we all have experienced trauma and it looks different for all of us. And so hopefully this will give you some tools and techniques on how to do that. So excited to talk to you all about that today, because I always learn something new from some folks. So excited to hear from you all too. Before I go any further, though, I'm going to hand it over to my fabulous co-trainer so she can introduce herself.
Thank you, Ari. Thanks, everyone. I'm happy to be with you all today. It's awesome to see so many people in this room and so many varied experiences and perspectives. So like Ari said, I just want to echo, please participate, please share your perspectives, your insights. We want to hear from you and give you the opportunity to learn from one another as much as we're here to share the content with you. So my name is Maya Baderi. I am a senior program manager with CSH on the special projects team. I am currently based in Boston, although I spent the last nearly 4 years at the CoC lead agency in Austin, Texas. And so delivered a lot of trainings like these in a different capacity, overseeing our community training series over there. So really stoked also just from a personal perspective to learn from another continuum of care and from different providers in another part of the country, and kind of how you all grapple with these kinds of concepts and approaches. So very excited to be here. Thank you.
Thanks, Maya. Okay, so I always forget to, you reminded me, I'm joining you out of Las Vegas, Nevada. So I'm close, but almost there. But I was telling Jamie, I'm from the Bay Area, from California originally. So happy to pseudo be home, virtually home a little bit with you all. So Just quickly, if you haven't heard of CSH, we're Corporation for Supportive Housing, or CSH. We're a national nonprofit where we have several lines of business, but the most important one is the one that we're doing here for you all today. Is we do a lot of training and education in communities. We also do technical assistance, consulting. As you heard Maya say, she's a part of a team that works on special projects that are really helping. Really, the overall goal is for CSH is we are really just trying to empower more communities to build more quality supportive housing and to retain that, right? We know supportive housing is a core intervention when it comes to combating some of the core reasons that we know people are experiencing homelessness, which is affordable housing, and then also making sure they have access to quality services and whatever that looks like for them, that they're getting those services so they can stay housed. And so knowing that that is a powerful intervention and the data proves it, that is the basis behind why we do a lot of what we do. And so we do lending, we do technical assistance, we have contracts, federally and locally to do this work. And then also specifically through the training center is we provide ongoing training curriculum that's available to the community. So you all are getting this, free of charge to your organization because the fabulous Contra Costa CoC is paying for it. But we also have ongoing trainings that folks can access individually if you're ever interested. So just putting that QR code there, just for a cheap plug, but you can also just find us at csh.org anytime. So we do a lot of different types of trainings, and but the most of what we do, the brunt of what we do, is going to be what we're providing for you all today here too, which is online webinars live with live trainers who have some experience, so they're able to facilitate the conversation with you all. But again, to Maya's point, we really like to make sure that these environments are peer learning. So we're going to always encourage you all to share from your experience, whether you're here on day 1 or day 1,000 plus. The idea is everybody has something to bring, everybody has something to learn, and everybody has something to share, or teach. So want you to hopefully lean into that. Jamie did go over a little bit of what we're going to talk about today, but just to reiterate and specifically talk about what our goals are to cover for you today, is how trauma shows up. So I'm gonna go over a little bit of that, how it shows up, how it impacts folks, specifically may impact the way, not only the behaviors that you're seeing, but the way people perceive some of the services and how they define safety and support for them. So we're gonna talk a little bit about that. And then Maya's gonna go into key principles of what it means to be trauma informed. And to Jamie's point earlier, go over those key principles and talk a little bit about how that you can apply that to your work. Of course, hoping you all can share some of that too as you're seeing it in the work that you're doing. And then overall, the end goal is just as our time together today in the next hour and 40 something minutes is really making sure that we reiterate what it means to be trauma informed. And as I said, I think it really is these two big concepts is first understanding what it's like and how it shows up, and then being able to figure out how can I apply these principles to really help folks. That in of itself is being trauma informed, right? It's really about how can we just be more compassionate and understanding for folks and offer grace, patience, and space whenever they need it to make sure we're really supporting them in a way that's effective and meaningful to them. So a lot of these norms are what we expect in most of our webinars, and sounds like you all have been experiencing too, based on the norms that Jamie, community norms that Jamie shared earlier. Just going to reiterate, we are going to ask you to use the chat a lot, and sometimes we use Menti polls, but I think for this group, it'll probably be easier to stick to the chat if I remember before. That's what really worked. It is a huge group, so it would be hard to get a lot of people off mute, but if you are compelled and want to share verbally, just raise your hand, and we can manage that as well. But just going to encourage you to use the chat to really interact with folks. We'll find opportunities to pause too, so you have time to reflect and think and enter things in the chat. I will just say, as somebody who is the self-entitled queen of typos, please don't worry about spelling or grammar. We're not going to judge that. Just, answer to the best of your ability in the chat if you feel comfortable. And again, if you want to raise your hand, we can definitely unmute folks who can share things, hopefully briefly, so we can keep things moving along. If you have the ability, it sounds like all of you are actively serving folks out there and doing great work in your community. So recognize if you need to, have your phone there for emergencies, or if something pops up, comes up and you need to attend to that, please do that. But we are going to say it's the best of your ability, and as much as you can, minimize distractions so you can be present with each other here and share with each other. But really the end all is we just want folks to enter this space open to learning and sharing, so we can create that peer learning space for folks. And before we go into that too, and I'll just pause to make sure there's no more questions before we like really dig into content. But just, we always give a content advisory when it comes to this course. Anytime we're talking about trauma, just wanted to let folks know that because we have all experienced trauma, some of you maybe have experienced vicarious or secondary trauma through the work that you're doing. And so if something comes up and it is activating, or you feel yourself getting a little upset, or you just need a moment, really want to just remind folks to take care of yourself in this space. We don't intend to, intentionally try to do that. And we're going to talk a little bit about how we don't always have control over, whether or not somebody does get activated or, triggered by past traumas. But we do know that, it can happen. And so just want to give that kind of space and that warning to let folks know we are going to be talking about trauma. We're going to be talking about probably traumas that if some of you had some of these experiences, it sounds like a percentage you have. But like I said, too, because you might have experienced some secondary or vicarious trauma, talking about examples of how that showed up in folks might be activating. And so whatever you need to do, grab a good stress toy, make sure you have water, but also, again, if something happens, I just encourage you to take care of yourself and always protect yourself and your own well-being first. We will still be here talking. You still have access to our learning action guide that has all the content, so please don't worry about missing any of that. Your wellness comes first. So before I dig into that, any questions about what we plan to cover today or any of that logistical stuff first? All right, well, let's just dig in then and talk a little bit about um, what does it look like to be trauma informed? And so, we've talked a little bit about overall how we're going to talk about it today. We haven't given you any definitions, but would love for you all to just sit and reflect and think about it. And if you feel comfortable sharing in the chat, for you, what does that look like? What are the first few words or ideas that come to mind when you think about what does it mean to be trauma informed? No right or wrong answers here either. Again, just want you to think about it and get a sense in the room. What do folks think about when they think you're trauma informed? Oh, thanks. Anna's first one out the gate. Being aware that it is a factor for myself. Yep. I see awareness of the impact, showing up, not judging or listening. Love that. A holistic approach for everyone, approaching with compassion. Oh, these are great. Seeing empathy. I love that I'm seeing a lot of awareness. Awareness there is a big part of it. Absolutely. Non-judgmental, meeting the clients where they at. Oh, yes, Bridget. It takes humility too. Absolutely. Really approaching this with some humility, recognizing we don't have to be the end all be all for folks. And it takes a level of humility to lead with compassion too, right? Trustworthiness, transparency, seeing compassion again, being mindful towards someone's past. Yes, and present. Love that. Absolutely, Brittany. It takes a lot of emotional intelligence on our part to really show up in that way that's non-judgmental and open, right? So I appreciate you highlighting that. Care, concern, safe interactions. This is awesome. Keep it coming, folks. Being aware. Yes, understanding clients have experienced some form of trauma, right? But all are impacted differently. Showing up, listening. All right, y'all got it. Okay, there's a couple more coming in. I'll just pause for a couple more seconds. If you're still typing, please keep throwing it in. We'll still read them. And obviously folks can still read your responses. I'm gonna slowly get us moving forward though, just to keep things moving. I like this long definition: to understand and approach with understanding that many types of trauma our staff and clients experience. Absolutely. Oh yes, wanting them to practice autonomy and being client-centered. Love it, love it. All right, thank you all for sharing. Really, I think it's helpful for us to get on the same page, right? To think we're all talking about the same thing. In a couple of slides, I'll share a definition, or actually Maya will share a definition too about what it means to be trauma informed a little later. But I think at essence is what you are all saying. And I think it's important, put in your own words first before we give you some fancy definition from Sansa, is helpful. But also, I hope this really reiterates too, which is what I like to tell folks too in this is we're going to share a lot of things that have really specific terms and definitions, but hopefully a lot of what we're talking about today is reiterating things you already know and are already doing. Because I think a lot of us come into this work because we are naturally compassionate or at least passionate about wanting to help folks. And so hopefully a lot of what we talk about today will validate some of the work that you're already doing. Hopefully you learn something new too, and hopefully just also empower you to go back in there and keep doing the work, because I know it's hard. But hopefully this validates to let you know you're in the right direction and you're doing work that will have an impact on the folks that you're serving at some point. So hopefully it does that. So first, let's just get on the same page about what we're talking about is trauma. If we put it in really, really simple terms, we're talking about, something that happens to a person when they've been harmed or they've had a life-threatening experience. And this causes like a long-lasting effect on the folks. So when we're talking about trauma, we're actually talking about that long-lasting impact that it has on folks. We're not talking about the actual event. We'll call that a traumatic event or, the source of the trauma. But when we talk about trauma, loosely here today, that's what we're talking about. It goes beyond, common stressors that we all have today. I think it's important for us to say that too, just because with the way our society is now, words and trends spread quickly. And we might hear people use this word loosely in terms of, oh my God, that was so traumatic. If something happens that was stressful or just very impactful. And that's not to say that that's not true for that person. Obviously, it looks different for everybody, but we just want to really be clear here. We're not talking about, small inconveniences or major inconveniences that happen day to day. That happens to a lot of us, but when it becomes to the level of trauma, or we're talking about trauma and how it shows up for folks, we're talking about something that has definitely had a significant impact on somebody, and it's had a lasting effect on them, meaning it goes beyond just that event or a couple months after that event. We're seeing this years down the line, how it's still impacting somebody, and really does impact their overall well-being in some way or shape or form. And again, we'll talk a little bit about how that looks different for everybody. A couple things just to keep in mind too when we're thinking about trauma and how it's defined or how it looks up for folks is some of you have already noted that in your responses about what it means to be trauma informed. One thing is, and I talked about this earlier, is you don't have to be directly experienced by somebody. So I talked about vicarious trauma or secondary trauma. A lot of us experience that too, just by hearing somebody's story, or loving somebody or caring for somebody that's experienced a trauma. We can often feel that impact ourselves vicariously, right? And so the idea is we don't have to directly experience it, but it can still have some impact on us. A lot of us may have experienced that too over, unfortunately, just the flow of information that comes to us thanks to the fact that we have a little handy thing always usually in our hand, our smartphones, or just online, seeing images of things, that impact us or impact people similar to us or we have similar experiences with, can still have an impact on folks or just add to trauma that we've already experienced. It's also important to note that, not everyone who experiences harm or a traumatic event will be adversely impacted. And we're going to talk a little bit in a second about how that might happen, because some of us do have innate or protective factors that are in our environments that help safeguard us towards how much we're impacted by an event or harm that's done to us. But it's just important to say that too, that, it's not going to always impact people the same, or even have people, have a significant adverse effect or negative impact for folks who may have experienced a similar event. It's also really important for us to think about too, is that we are all going to experience trauma differently, right? It can show up differently, again, whether it has a serious negative effect or not, but also we'll talk a little bit later about just how that impacts us moving forward, how we're even activated or triggered by future traumas or future events, is all going to look different based on what we're born into, the characteristics we're born with, but also develop along the way based on our community and various experiences. It all is going to impact us a little bit differently. One example I like to give just to kind of take it home for folks, and then we'll talk a little bit about actual protective factors, is if you imagine being in a car accident, right? And so imagine Maya and I are both in the car. I happen to be the driver and she's the passenger. Just by the sheer fact that I was the driver in control versus her not being in control is going to have a very significant impact, a different significantly impact the differences in how we are impacted by that. There's too many impacted in that word in that sentence. Sorry, guys. How it shows up for us, how we experience it is going to be different too, right? I may see things differently as the driver. Maya could have been looking at her phone or looking at the side of the road and not even seen it coming. That in of itself can be very different. And then there's a whole other thing with our past experiences, right? Like I can say personally, I've lost loved ones to car accidents and I've experienced very significant car accidents in my past. And so any kind of little, fender bender like that can be activating for me, right? And so it's going to show up very differently in how, not how I just immediately respond in that accident, but then also the long lasting impact of it. If it's triggered, wounds that I had that I hadn't quite healed yet or thought I healed, it may feel a little differently. Or because maybe I've done a lot of work on that and I have some skills and some coping that's really helped me deal with that. If I employ those right away, then maybe it will help me minimize the impact of this new event. And so it's just important for us to kind of think about that. And I just use that real tangible experience. Again, sorry if that's activating for folks, but I think it's important for us to kind of have a tangible experience that we can really all relate to and how it might show up a little bit differently for folks. Does that make sense for folks? Okay. Love that some of you are on camera and I get those nonverbal head nods. Thank you very much. Appreciate that for that. Okay, so in thinking about, again, what are some things that might impact the way trauma shows up for folks or the effect that it has on us, what we're going to introduce is this concept of protective factors. And so what we're talking about here are things that may safeguard or protect us from trauma or can help us recover quickly after trauma has been experienced. So just gave a quick little snapshot of that, thinking about a car accident experience, but this is really any experience that folks have. So if you're thinking about things that might safeguard folks, that might protect people from the overall impact or the lasting impact trauma can have on folks or an experience can have on folks, what comes to mind? What do you think of when you think of that? We're going to share a couple in a second, but would love to hear from you all first. What have you seen maybe in the folks that you're serving or just you personally that you've experienced that's probably you think might has contributed to helping you either recover from an experience more easily or quickly, or maybe not let that experience harm you as much as it may have harmed others. Thanks, Unique. Yeah, family, friend support. You guys got it right to it. That social support and having a support system is key. Absolutely. I think you remember qualifying that too, right? It's not any support, it's healthy and active. Absolutely. Faith, community. Yeah. Finding coping methods. Absolutely. Meditation, any kind of mental wellness training. Absolutely. That emotional intelligence that I think somebody brought up earlier can speak to that. We've been working on that. Yeah, thanks, Marvel, for highlighting that. Being able to talk to somebody through, right? One thing to have the support, but some of us really need that talking and external processing really helps for folks. Therapy, support groups. Okay, folks are getting into different services folks can utilize. Absolutely. Yes, Polly, deep breathing is a key thing. We talk about that a lot too, especially when we talk about we have a course that digs even deeper into understanding trauma and how it shows up for folks, but just connecting breath to that vagus nerve that we know is what helps control and monitor our overall systems, helps us get down to baseline is really, really important. Engagement, spiritual support, journaling, therapy, community support, absolutely. All right, you guys are on the ball right there with it and really kind of I always try to think of nonviolent things. So I say nailing it, hitting it on the head. Those all feel very violent references. You guys are really pointing out or keen into some of the real key concepts that we're wanting to share with you today about protective factors. So thank you. You gave some more specific ones, which I think are really important. These are kind of general overall ones, but all getting to similar factors, which are, key things that we know that can help protect folks that both a lot of them are externally offered and some of them can be more internally developed over time. And so just wanted to highlight that too. What I love to highlight to you is a lot of these things that are on this list are things that y'all are doing actively for the folks that you're serving. So I feel like that's one thing that you can check and say, this is something that we're doing that is trauma informed and absolutely supporting folks, is you're providing things that are going to be help protect them or at least provide some level of safety for them should they ever experience trauma again, or at least be activated by past traumas. And so one is key, right? Providing that safe, secure housing for folks. I saw that some of you are providing ancillary kind of services to folks. So some of you might be offering vocational or employment services, which is absolutely important, or at least connecting them to key benefits that'll help them increase their income in some way or form. Education, healthcare. A lot of you nailed this last one. Housing supports, social supports as well, having a social network. There is something to not having previous experience with trauma, right? So if it's something that's new and it's a new experience or new harm, sometimes that does help us, react to a new experience a little bit better, because we're not being activated and we're not, digging up old wounds. You guys talked about access to support, and then I think you guys named a ton of others that I think are really important, and like specific tangible tools that you can be offering folks when it comes to safeguarding them. So now that we've shared a couple and you've seen some that folks have shared in the chat, is anything missing that folks want to add that we haven't already shared? Yeah, and thanks, Ronald's talking about just the active act of recognizing it, right? And being aware can really help folks move forward. Hey, Evans Otter. Okay, thanks for sharing. Anything else about that we haven't shared? All right, I'll keep us moving then. So it's important to recognize these. As I said, these are things that we can be looking for, for being strength-based in how we work with folks, being able to elevate those and notify, or not notify, recognize those and notice those in the folks that we're working with are going to be really important in helping them in their healing journey, and also helping them continue to feel resilient and build the autonomy, and all the fabulous things that I know you're doing to work with the folks that you're serving. It's also equally important for us to recognize that there may be things that folks have experienced that have the opposite effect, right? Not in many of these things, if not most of these things, we don't always have control over, but an awareness of that can also help us, really prepare for and understand why trauma or folks might be behaving differently when they do experience harm or activated by a past trauma. And so it's important for us to also recognize that some of us unfortunately are born into or have experienced some things that maybe develop into risk factors for us, meaning that they make us a little bit more vulnerable or susceptible to having a more long-term negative impact on trauma, or just make it a little bit harder for us to recover. Maybe because it's, maybe takes us longer, or maybe take us longer to figure out what that recovery looks like. But if you think about what a risk factor might be, what would you guys think of there? Or what are you seeing in the experiences that you're having and working with folks um, deal with or work on their recovery? What might be things that are making that a little harder for them or a little more challenging? Disassociation. Thanks, Erin. Yeah. Not being able to clearly connect to that makes it harder for us to really overcome that, right? Cyclical crises. Yeah. So ongoing exposure to the same thing in our environment. Oh, now it's coming in. Substance use. Oh, thanks. Somebody's highlighting ACEs. Absolutely. Past trauma, which can definitely have an impact on folks, especially if they happened in our childhood. Negative environment, mental health issues, mental health, absolutely. Isolated, unhoused, absolutely. And then, right, lack of the support system. A lot of it is like the opposite of what we just named, right? Of the things that help folks. The absence of those definitely make it harder for folks. Jamila, yeah, again, trauma, childhood trauma, ACEs, a lot of the things that are in ACEs, if folks aren't aware, so childhood, adverse childhood experiences, and I'm just quickly saying, I don't think we mentioned it in this course, but are those experiences that, forms of abuse or neglect that can show up for folks we experience them in childhood. Research, a ton of research has shown that they have long-lasting impact on folks. And part of those adverse experiences can be past harm, past trauma, or absence of some of the things that you guys are talking about: stability, an effective support system, stable environment, absolutely. Isolation, overall surrounding. Yeah, if we're living in spaces or communities that, you know, cause harm or have violence, it absolutely can impact us and our ability to recover. All right, I think you guys got it. I'm not going to belabor the point. Many of these things you guys did already highlight. So past experiences of trauma, housing instability, or actually experiencing homelessness, any kind of experience of oppression or any ism, I would argue, is there, but specifically there's a lot around racial trauma. And so experiences around racism is absolutely there. Institutionalization, which many of the folks you're working with probably have experienced. And that's really just another kind of oppressive harm or experience that folks have had, where people's rights and freedoms is severely hampered, if not stripped completely, right? And so recognizing how somebody recovering from that or having past experiences in that can be it definitely impacts their road towards recovery and healing. You guys already talked about having mental health issues or illnesses, overall health issues, other health issues, right? I know many of us work with folks that have serious chronic health conditions. And so managing that and the stress and anxiety of managing that obviously can have a significant impact in folks, especially if a lot of your energy is focused on that. It can be hard to focus on other forms of trauma and harm that they may need to recover from as well. Talked about lack of support, unhealthy relationships, and then other experiences in other systems definitely can have created past harm, but also pose as a risk factor. A lot of this we know probably just from working with folks, but just to say that a lot of this we also like to share too, because there is research and support around that shows that. And again, hopefully this kind of gives us the baseline understanding or just like a common understanding of how that can impact folks and hopefully put us in a position to know if we're working with folks that we know do have these risk factors in their lives or in their histories. Hopefully it puts us in a place where we can offer them a little bit more grace and space to recognize that what recovery looks like for them might look different, but also the timeline of it is going to look different. So we say recovery is not linear, right? And it's definitely not on any kind of set timeline or path that we would hope for folks. It really is based on what works best for them, where they are and where they are living. Okay, so we've talked a little bit about, basic understanding of trauma, how it shows up, or how the risk factors or protective factors that might be helping or hindering folks' ability to recover from that trauma. Um, want you to think about, and the people that you're working with, what are you noticing and how it shows up? Because then we're going to talk a little bit about the impact of trauma. What are some behaviors that you might be seeing that could be linked to somebody's trauma or might be caused by trauma? Seeing anger, substance use. Anger is a common one we see a lot. Childhood abuse, dual diagnosis. All right, so some of you are already skipping to like actual outcomes, right, that we're seeing, or emotions, feelings that folks may have. Absolutely appreciate that you're recognizing that those can be connected to trauma as well. I see violence, right? Okay. Avoidance, depression. Oh, thanks, Camila, for highlighting lack of participation, right? There's probably a reason behind that, but the behavior that we're seeing is just somebody's not participating, right? We don't know why, but a lot of times it could be linked to trauma, lack of trust, or understanding of what participation means when we're asking them to join a group or engage with a case manager. Anger, paranoia. Oh, y'all are seeing a lot. Okay, violence, emotional, vacation management, distrust. Yeah, sometimes it looks like self-sabotage and then following up, not getting access to housing opportunities that we're working with them on. Oh, Vicky, that's very specific. Yeah, stutter and speech, hoarding. All right. You guys are getting it. It's, some of these things. Oh, sorry, I accidentally moved. Okay. Somebody will let me know if I'm frozen or choppy. Okay, I got a warning that says my internet was unstable, so just let me know. Yeah, so a lot of what you all are talking about are what you're noticing. Some behaviors, some are like emotions or just kind of the way folks show up. And really, I appreciate all of that because what's really important is for us to recognize any of these things, which many would argue, right, are behaviors that could be challenging or emotions that show up for folks that might be difficult for us to like gauge and kind of work through. Um, they're all things that, may, if we weren't trauma informed, we may just kind of totally associate towards a negative bad thing and want to move on and not work with somebody on them. But because we're trauma informed, hopefully, at least now or by the end of our time together today, you'll see that we can hopefully see these things a little bit through less judgment and more compassion, and recognize that a lot of these things aren't active choices folks are making, right? These are learned behaviors or things, or just, unconscious responses people have because of the experiences they've had in the past. And so I think that's really important. And I love the like, I'm not going to belabor it, but the stutter and speech one I think is really, really important, because folks often, if we're not more aware or more educated about, some of the mental health and cognitive processes that go behind what causes somebody to stutter, and may feel like they're doing it on purpose or that's something that somebody can easily control. But recognizing that that is just one simple, very, specific behavior that happens that absolutely sometimes folks have worked a long time to overcome, but they don't always have control over. And so when it does show up, and when it is, or it is more pronounced in somebody, as a great indicator that something's happening for that person and they may need additional support, or at least we can get a little curious about why that's happening for somebody, so we can hopefully find what is the best way to support them in those moments, but then also moving forward as they come that as a challenge, because unfortunately that does impede in people's ability sometimes to communicate, or just other folks judging them because of that. Okay. So as we talk about how it shows up, and we're going to really hit on some of the things that you guys have already outlined and what you're seeing in folks and how trauma shows up for folks, we're going to get a little geeky about some of the brain science behind it. I'm not going to go too geeky and get into too many technical terms, but we are going to really focus on, how it impacts our brain and the way it impacts the way our brain works when we've experienced trauma, because it really is going to hopefully hopefully kind of give you the background or the basis behind some of the behaviors and emotions that you're noticing in folks that you're working with, and being able to connect them to why that might be happening for folks, more or less than others. And so the best way for us to do that too sometimes is if we can just all kind of talk about one person or a case study or an example to help iterate how that might show up for folks. So I'm going to introduce you to our friend here that you see on the screen named Jay. I'm going to tell you a little bit about his background, and then we'll walk through, how that shows up for folks and how that impacts folks. So if we keep in mind that, there is no typical, quote unquote, typical or normal way for trauma to show up, we're still going to share this with Jay. And so this at least gives us some common thing to like relate to. But again, we're not saying that Jay represents everybody or is like a typical or quote unquote normal way for folks to experience or deal with trauma. But he does have some kind of overlapping experiences with folks that may be working with. So that's why I think it's important for us to all kind of think about Jay as we work through some of this. So this is Jay. He's experienced homelessness for several years, and he was incarcerated for over 3 years. He's also struggling with his meth use and managing that. He's and we're just going to imagine Jay's not a real person, obviously, but we're going to imagine Jay's experience, to some of you recognizing that earlier, some experiences in his childhood that definitely had a negative impact on him. Specifically, he did experience some neglect and abuse from his parents, and actually spent some time in foster care, brief time in foster care because of that. And so in thinking about Jay, it's important to think about when someone's experienced the type of harm that he's experienced, especially experienced from others, this gets imprinted in our brain now, right? And so for Jay, those past experiences have been imprinted in his brain, whether he's consciously aware of that or not. And so what has done is, because of these experiences, it's put him in survival mode, because he's been unfortunately had experiences where that is what he's had to focus on, is his immediate survival. And so it's important for us to know that and remember that, because, when a brain is in survival mode, it really wants this person to remember the harm, right? They need to remember the harm because this helps protect them from future harm. And so it absolutely is kind of an innate response that all of us humans have. But if we think about it, it is in a way a very helpful response too. Because we need to be able to recognize, once we have had harm and we've had harm placed on us, especially by others, it's important for us to recognize what those factors were and why that happened, because that can help us prevent that from future harm. And so a lot of us do that not even completely aware that that's what we're doing. But it's important for us to recognize that this is something that our brains are designed to do to help us. And it's important for a lot of reasons. And how it shows up and how it impacts folks long term is that, even though this is our brains are doing this to help us socially, and because we are moving through different, communities and different spaces, it may show up in a way that makes things a little bit more challenging, especially when it means to forming new relationships or trusting new folks who are in our environment now trying to help us, such as you all, right? So if we're working with Jay and we really want to help him, what's important to know is some of the behaviors we may be seeing in him might be connected to this concept of, his alarm system is now being distorted because of those past traumas and because it's been imprinted in his brain. We may see that Jay shows up as a little bit more hypervigilant, right, and does not easily trust us. Again, this may not something that he may be consciously doing it and aware of it, but it might be something he's not even aware that he's doing, but it's because his childhood has told him people are the source of harm, right? Any pain or past experiences that were harmful to him that he may have had, most likely were brought on by somebody else, right? By a parent, by somebody in the systems that he was in. And so it is not, inconceivable, or one might even argue it's logical that his brain has created that imprint in his brain to say, if somebody else has harmed me, I need to make sure that I don't let anybody else harm me again. So it is a protective thing. It might be helpful for him, moving forward in his life to learn people are a source of harm. So I'm not going to be so easily trustworthy of those people. It may feel like on our side that we're having to work extra hard to earn his trust. But if we put ourselves in Jay's shoes, it makes a lot of sense. And it's actually quite reasonable for him to be behaving that way. And so us as the caregivers, us as the folks that want to help and earn his trust, just knowing that and being able to have some patience and understand that we might have to try different things to earn his trust and maybe others is going to be really important, and hopefully put you in, a space of more success and probably in a better space to help him, because you're coming to him with that type of understanding and compassion. Other ways that it might show up too is trauma can definitely interfere with our ability to evaluate, appraise, or even understand our present circumstances and learn from experience. Again, because trauma has such a significant impact in our brains, it's much more impactful. A negative event or experience is going to be 3 times more impactful in our brain than something that is positive. And so understanding that, and that's the way our brain works because it is a way that we protect ourselves, is going to be really important to, for us to understand, because it may take Jay a little bit longer when it comes to trusting, not just trusting folks, but also learning from new, more positive experiences, right? Because in Jay's experience and how he's shaped to see the world, again, people are harmful, people aren't trustworthy, and he needs to constantly protect himself from others. And so it may feel like he's unapproachable. We've got that lovely picture of him. He doesn't look like somebody that wants to be talked to right now, right? He may seem defensive or standoffish, but if we're going to come and we're going to be trauma informed as a trauma informed practitioner, really what we want to consider is asking ourselves, what happened to this individual first versus what's wrong with them? And that's really important change in perspective that trauma informed approach really emphasizes. And you'll probably hear me say and Maya say more than once is putting ourselves in a place of really asking and getting curious about what happened, so we can be a better support instead of just going straight to judging and saying, oh, Jay's going to be that difficult client, or Jay is just too standoffish. I'm not even going to waste my time, right? But if we can change our way of thinking, then we're going to absolutely be more successful and more helpful to Jay, in the present, but also hopefully in the future, long term, as we work with him over things. It's also really important to recognize that, experiencing trauma can lead to folks feeling this continuous feeling of fear. Some of you already highlighted maybe isolating ourselves from others, and turning away from support. Again, if you think about the experiences that Jay has had, this is all because he wants to protect himself from future harm, right? So instead of seeking help and wanting to talk to somebody, it may feel better just to isolate and stay somewhere quiet, calm, where he's in more control, because a lot of his experiences has been around other people controlling him and his environment and his livelihood, right? And so being able to feel a sense of control, a lot of folks turn inward, which also means they shun or maybe reject outside help. Again, this is all not uncommon, and it really can be a natural or common experience that folks have when they've had harm. because of the imprint it has in our brain, and our brain telling us, again, whether we're aware of it or not, that other folks are a cause of harm, or maybe I shouldn't trust folks, especially folks with a clipboard, or especially folks that say they're here to help me, because folks have said that in the past and that hasn't worked out, right? And so being aware of that can be really important for us as we work through and think about the different ways that we can support and help Jay, but also a lot of it might be focused on demonstrating to Jay that we can be somebody that he can trust. Also, what we know about trauma is a cumulative impact. So the impact that adds up to all the experiences that folks have had, especially when the trauma is unresolved or folks haven't actively worked towards what that looks like when it comes to healing from that trauma for them, is, it can lead to people feeling powerless or helpless. And I think some of you alluded to that too in some of your responses too. And so that can mean that, he doesn't ask for help when he wants it. If Jay's, not feeling well, or he may injure himself, he may be less likely to seek help and not want to go to the hospital or not want to ask somebody to help him. Because again, he may feel like this is just how he's supposed to feel, or, these are all consequences of his behavior, and he deserves this. If folks have constantly been told that, whether either blatantly or just through their experiences of constantly feeling negative impacts or constantly feeling like they're being punished, then they may kind of, accept that and think that that's just how they're supposed to be and that's how their life is meant to be lived. And so if you already feel this powerlessness or feel like you can't change your own well-being, or you can't get help when you need it, then folks may just, feel helpless and be like, why bother, right? Why should I bother asking for help if, I think it's going to either create more harm, or I feel like people may not believe me, or I feel like I can't trust folks to give me the help that I want or need. Absolutely happens. And what we might also see too is, because of that isolation and that sense of powerlessness, it could also mean that we see things that might be seen as more risky behavior or self-harming behavior, which we know Jay's engaging right with his meth use. If he's not using some hopefully harm reduction techniques, or he's not using isolation that is putting him in a lot of harm, right, and susceptible to overdose or even other negative consequences we know using an illicit drug like that can have on folks. Oh, thank you, Leticia, for sharing that and being so vulnerable. Absolutely. And I use that example because I had a tenant tell me that too. Seeing that can absolutely trigger something. There's something about the power and the image of a clipboard. And unfortunately, folks that have that, even folks in white coats or, in buttoned up ties, all of those things, if you can connect them directly to a negative or a really traumatic experience, absolutely, it'll do that. Thank you for sharing that. Another thing that people maybe experience, a lot of this is based on, the society that we grew up in. It might be cultural, but I think overall, it's not uncommon for folks to also, have the lasting impact of trauma also lead to some feelings of shame, guilt, stigma. Some of you all talked about anger, which I think, could be something that also is that, but also many times when people do experience shame or guilt, it can look like anger, right? And so recognizing that is also really important, that folks may seem angry. It may be just because they feel distrustful, or it may be because they are feeling a lot of stigma, and anger might be really totally pointed inward, which is where that shame and blame comes in, right? Is that they may be angry at themselves, or they may blame themselves for some of the experiences that they've had. And so that can look like, somebody not wanting to engage in services. It can look like somebody, really being standoffish, or even being in denial of any of the feelings that they're having, right? Because they don't want to share or open themselves up to be vulnerable, because they may think whatever they're feeling is inappropriate or unwarranted, or warranted if we think about the shame and guilt piece of it. And so being able to recognize that is also going to be really important for folks as we think about what is the best way that we can show up for them and help them as a way to. Yeah, thanks, Stephanie. It is absolutely a secondary emotion. Thank you for highlighting that. So it's important for us to recognize that as well, because again, when somebody's reacting to trauma, and something that they've experienced, it's also important for us to recognize that this is absolutely impacted by their own background, whether it's culture, spirituality, the types of supports and life experiences they've had. All of that impacts not only how they manage it, but also how we actually interpret and, label what we're feeling and experiencing. And so it's going to be really important for us to recognize that. And we'll talk a little bit about later too with the last principle that Maya will talk about, but because Jamie mentioned it earlier, just want to say that is kind of the key to cultural humility. When we are thinking about cultural humility, it's really about being open to understanding how other people's experiences is going to make them show up, um, communicate, and perceive things differently than us. And so we can't make assumptions about what that means for other folks, because being culturally humble means recognizing that we come in with our own experiences and biases. And so making assumptions would mean we're basing all of our experiences and, understandings of other people based on our own experiences. But being humble really means we have to recognize what we've experienced is what we've experienced, right? Others are going to be completely different. And so we need to just be open to understanding and learning from them, and recognizing how it may look different for other folks. And really that is just, again, making sure we're evaluating ourselves, checking our own biases, and again, making sure we're not jumping to any conclusions or assumptions, but staying in that space of curiosity and not judgment will really keep us there. That helps us stay trauma informed, but it also, I think, puts us in a better place to be truly helpful to the folks that we're serving, because we're actually listening to them and responding to their needs, and not just assuming based on our own experiences. Just recognizing folks have put some great things in the chat. Yeah, I appreciate you saying that too, Aisha. People get tired of telling their story. Okay, so I'm gonna go on one little tangent too. My big thing too, as I always say, is data sharing, or ROIs, releasing of information, being able to get the permission to share some of that information for folks behind the scenes is absolutely trauma informed, for that very reason that Aisha is saying, is every time somebody has to share their story, we're putting them and through that trauma again. And every time they share that story and they don't get the help and support they need, they're also getting signaled and told that, this system's not meant for me, or this system is going to fail me again. So I really appreciate you saying that. And so just knowing that is one thing, but also finding ways and creative ways to get around that and demonstrate to this person that you do want to help them, and that we don't have to re-traumatize them every time for them to get the help that they need, is really, really fruitful. And I just encourage folks to think about ways that you can do that within your role and your realm of control. All right. Let me keep it moving. I see folks have to leave, and that is quite all right. Understand y'all are busy folks housing and keeping folks housed, so appreciate that. Just going to quickly, before handing over to Maya, also talk about what often comes up too when we talk about being trauma informed. As we said, a lot of folks really want to work on, like, how do I prevent somebody from being activated, or how do I prevent them from being reminded of past traumas? And a big piece of it is this is a part of the journey for folks. We can't remove and eliminate all triggers from folks. They are going to have experiences. There might be things that we do or say that we don't even recognize that could be a trigger and activator for somebody. Um, but the first thing that we can do about being trauma informed and more supportive is just recognizing that that is a part of the journey. It is a factor in life that we all have to navigate through, because we can't 100% control our environments, right? And we definitely can't 100% control other folks and how they show up. And so when we talk about triggers or something that's activating folks, that's essentially what we're talking about, right? It's something that either consciously or unconsciously reminds us of a past. It's most often connected to one of our five senses: sounds, taste, smell, sight, and touch. It looks different for everybody. I will say that I've learned that one of the strongest connector senses that connects us to memories is the sense of smell. But we don't always are aware of that, right? And so being curious and asking questions can really be helpful for folks. But you may work with somebody who gets really activated by the smell of gasoline, right? Maybe something happened to them where they were at I don't know. There's a million reasons why that could be activating for them, right? But being aware of that can put you in a better place to help serve somebody. And may they not be aware of it either, but that's where we have the luxury of being not in their space and not in their head, and being an outside observer where we can make some of those objective observations to help them kind of understand how do they build an environment that feels safe to them. And so, like, I had a tenant for one, it was, she couldn't be in a space where she could see the road, because seeing people walking by was very activating for her. She had high paranoia going on with her connected to her illness. Um, but recognizing that seeing folks walk by her window was super, super activating for her, was really helpful for us because that helped us understand what is the best placement for her. And she couldn't voice that to us. We had to learn that through showing her different spaces and seeing her respond. She was not able to make that connection in her own head yet. So being aware of little simple things like that can be really helpful in demonstrating that you care and you're want to support somebody. But also, like I said, some folks sometimes we're not aware of it. And so us being able to help connect some of those dots for folks can really be one of the key ways that we can be super, super supportive for folks. Another thing that's also important to remember if we do want to address triggers is one, like I said, the best is just be sensitive to them and recognizing that they can happen. It is a common experience in everybody's healing journey. So not trying to place any blame or make somebody feel bad when they are activated is really going to be important. But it's also really important for us to know that to take note, to take those observations so we can do what we can to help avoid it. Being very clear for folks and asking questions about what space would they feel comfortable talking to us in, where do they want to meet with us when we're talking about certain things can be really, really helpful. And so again, that's a big part of being trauma informed is trying to find that. And Maya's going to talk about that in a little bit. How do we create spaces that feel safe and comfortable for folks? But also hopefully just recognizing for ourselves too, to give ourselves some grace to know that we can't eliminate them completely. The most that we can do is really work to reduce their exposure to them whenever possible. Again, I can give an example of some folks that like a waiting room and some of the things that are happening in a waiting room can be very activating for folks. Sometimes it's the bright light, sometimes it's too many people talking, too much space moving on. And so we can't control a doctor's waiting room, right? But what I've done with one tenant was they waited in the car until and then I went out and got them when it was their turn to enter the doctor's space because they couldn't handle being in the waiting room. It was too activating. There's too much going on, but they still needed to see their doctor, right? And so those are small little things that we can work on to think about. Again, it was the luxury of it was two of us that were escorting her to the doctor's appointment. So one was in the waiting room so they could call the other one when it was their time. But just an example of little things where we might be able to do it or might be able to get creative, but we also have to recognize if I couldn't do that with her, right? What can I do? Talk to her and also figure out what's the best way to support her. Maybe we go right at the time of her meeting, other things that you can do to really support somebody through that. Any other things or examples folks have, I guess, of that too, of how you've been able to make some adjustments to help somebody when they were activated in a space that you maybe didn't have control over? Just curious. All right, quite all right if you don't. I'm going to turn it over to Mike because she's probably going to give you a million other things and ideas that you can think of as we work through the principles.
Thanks, Ari. And we do have some examples coming in. Learning what past
yes.
interventions have helped, nonverbal communication, grounding techniques. These are awesome. Y'all are making a perfect segue into kind of how we actually put all of this knowledge around what trauma is and how it can show up and what it can feel like, how it can get triggered for folks. How do we use all of that information to be informed in our approach to folks? As Ari said, we can't eliminate trauma. We certainly can't go back in the past and make the event or experience of the event go away. And we also oftentimes can't eliminate the triggers that activate the body's trauma response. And so, like a lot of you mentioned at the beginning, being trauma informed is about having awareness and being responsive. So, yeah, being careful of your approach, of your tone of voice, being cognizant of like what your body does that might trigger other people, like moving quickly or talking loudly. All of these things we're going to get into when we talk about the principles of trauma-informed practice. So thank you for leading us right there. Ari brought up an example of a doctor's waiting room as a place that can be triggering for people. And we can move to the next slide, please. Oh, I can control it. All right, I'm going to try it next time. So in thinking about going to a new doctor, I think for a lot of us, even if we don't have a trauma that's specific to a hospital or a medical experience, going to a brand new doctor can just be a stressful experience, even if it's not traumatic. And so I'm curious, like in that moment, whether it's a trauma trigger for you or just kind of an uncomfortable or stressful experience for you, what are some things you can think of that would make you feel more comfortable in that situation where you're going to a new doctor, a new doctor's office, maybe meeting someone for the first time to talk about, you know, something obviously that is private in your medical experience. Stephanie saying doctor explaining what they're going to do before a procedure. 100%. Yes. Staff supports would help for sure. The doctor explaining what they're going to do is so critical because it speaks, I think, to not only informed consent, predictability, you knowing what's going to happen, giving you the space to ask questions, to say, wait, can we do it this way instead of this way? It opens up the space for a conversation. Asking consent, yep, calmness, providing options to treatments, pros and cons and risk factors, again, bringing you in as a participant in the conversation and in the decision-making process, bringing a comfort item. I had a client who would handle anything if she had something squishy to hold. I love that. That can make such a difference, going back to what Ari said about the sensory input, providing both a trigger, but also potentially a comfort in these moments. Telling the front office you're new and nervous so they have a chance to be extra mindful. That's a great idea. Yeah, communication, not being rushed, being offered a choice between a male or female doctor. Absolutely. Trusted support person present, hospitality of staff, being welcomed, being heard. Visiting before the appointment to become acclimated. I love that. So you're not entering a physical environment for the first time. A listening ear, being told up front if there are delays and how long you might have to wait. Yes, that speaks again to kind of knowing what's going to happen to you and what to expect from this experience. Preparing questions ahead of time. Absolutely. These are all really, really great, and I think speak to a lot of what we think about as trauma-informed approaches. So again, even if you don't have trauma around going to the doctors, having these kind of thoughtful and responsive approaches there can be can meet a lot of people's needs, even if they don't have a specific trigger associated with the experience. Ari, I am not able to move ahead. Would you mind moving my slide? Thank you. Okay, so I want to just, I think you all know what it means to be trauma informed. We've talked about it in a lot of different ways, but I want to give you kind of the official definition that we're using here. This comes from the Substance Abuse and Mental Health Services Administration, or SAMHSA, who says that trauma-informed care, sometimes you see that as TIC. We're using trauma-informed approaches as an alternative to that, is the adoption of principles and practices that promote a culture of safety, empowerment, and healing. As Ari mentioned before, it's moving away from this idea of what's wrong with you to recognizing that folks may have gone through things that we are not aware of, or that we may have experienced differently, that are impacting the way that they're showing up, and bringing that awareness as well as kind of humility and empathy and curiosity to really center their experience and promote safety, empowerment, and healing. And I love that you all are continuing to put your perspectives in the chat. Please, I'm going to keep moving, but as we said, this is a peer learning space as much as it is a presenter teaching space. So I encourage you to keep putting things in the chat for other folks to learn from. And as we go to the next slide, breaking down a little bit more what a program or organization or system that is trauma informed looks like. we refer to this as the 3 Rs. So in SAMHSA's kind of concept of a trauma-informed approach, a program or an organization, a system, a structure, an institution that is trauma-informed realizes the widespread impact of trauma. So that's that awareness piece a lot of you brought up at the beginning when Ari first asked you what your definition of trauma-informed approaches is. Recognizes the signs and symptoms of trauma in those you work with. That's why we spent kind of that big chunk at the front end of this training, really talking through what trauma can look like. Responding by fully integrating knowledge about trauma into policies, procedures, and practices. And that's a bit of what we're going to be talking about in the latter half of this training. The idea here is that, again, we can't undo the harm that's been caused, but we can seek to actively and proactively resist re-traumatizing folks. And that is a partnered process. That is not something you are solely responsible for. That is something you do in partnership with the folks that you work with. And so it's really based on a relationship and a collaborative approach. Trauma looks different for everybody. I think, Ronald, you said something earlier on that trauma is a unique experience. And as Ari said, she and I can sit in the same car, experience the same car accident, and walk away with 2 very different experiences of the event and impacts from that experience. And so really working with the individual to understand what their triggers are, what their coping mechanisms are, what their own definition of healing looks like, so that you can kind of work together to build that proactive resistance plan to re-traumatization. So moving ahead, we're going to look at SAMHSA's 6 key principles of a trauma-informed approach. We'll look at each principle in turn. These were listed at the very beginning, and we'll go through them one at a time. You all have mentioned most, if not all of these already in the chat throughout this process, which is really awesome. So I know you know, and I'm hoping that you will continue to kind of provide examples in the chat and your interpretation and perspectives as we move forward. So the first principle we're going to talk about is safety. By safety here, I'm talking about physical safety, emotional safety, psychological safety, at the individual level, therapeutic, familial, community, and organizational level. Trauma has an impact on the person's feeling of safety. And I think especially when we talk about the folks that come into your programs, experiencing homelessness, whether sheltered or unsheltered, is fundamentally an experience of a lack of safety. And that's something that impacts the body internally. If we think about kind of the hierarchy of needs, aside from that first pillar, which is physiological needs, shelter, water, food, safety is the second pillar. And so I think it's critical to recognize that if a person does not feel safe, it's going to be very difficult to be able to work with them on these other aspects of their treatment plan, of their housing plan, to interact with them, to build a relationship and move towards that partnership that I talked about, without safety first and foremost being addressed. So let's talk about that a little bit more. If we go to the next slide, we will return to our friend Jay and talk about his feelings and his experiences about being in housing, and some concerns about him maybe experiencing a lack of safety or engaging in some unsafe behaviors, whether that's self-harm or substance use or something else that you and him both kind of recognize as not safe. What are some ways that you all can think of that would promote safety with regards to Jay's experience right here? how would you kind of first and foremost approach this safety concern? Building rapport and understanding his why. Yeah, absolutely. Yeah, going back to that example from Ari, maybe it's the fact that he's facing the street or the fact that it's so quiet. And the simplest solution is you can just turn on the TV and let him know it's totally fine for him to sleep with the TV on. That might automatically change his experience of safety. Daily check-ins to ensure he has everything he needs. Yeah, just knowing that someone else is there and who cares and who's checking in every day. Active listening and validation, absolutely. Being aware of body language when engaging with him, totally. That's also important for de-escalation and ensuring that his lack of safety doesn't spiral into behaviors that may risk his or other safety. Validating and offering suggestions, don't judge. Soft approach, building rapport, reaching out and checking in, definitely. Coming up with a safety checklist to follow. I love that, Camilla. Thank you. Eye contact, respecting his space, and reinforcing that this is his home and we are now guests in it. That's a really great point. I think that's a huge part of safety for folks who are transitioning from experiencing a lack of housing to moving into housing. It's not I think sometimes that experience can be very overwhelming, and the cognitive recognition that I am in a home now and there are 4 walls and a door that I can close, that doesn't always happen at the same pace as the body's recognition. And so his body might still be really, really activated, even though he's physically in a different environment now. Asking if there's a specific way we can help, check-ins, listening, encouraging to unpack. I love that, Aisha. Yeah, that's a really, I think, powerful way to help him kind of reinforce that that piece from Hallie, that this is his space. Yeah, that's great, everyone. Thank you. And I think a lot of what you all were talking about around checking in, listening, ensuring that he knows that you're there for him leads us to the second principle of trauma-informed practice, which is trustworthiness and transparency. And this is really the kind of key component to relationship building from my perspective. This is about following through, being reliable, doing what you say and saying what you do. Like some of you all have mentioned in the chat, a lot of folks come in with a lot of distrust, a lot of avoidance, a lot of trust issues, paranoia. And this is not, it doesn't come from nowhere, right? It comes from repeated experiences of being let down by various systems, by various people who were supposed to or who said they would do certain things and weren't able to or weren't willing to. And so being able to be that consistent, predictable person in their lives can make an enormous difference. And part of that means being open about not only what you can do, but what you cannot do, being realistic about timelines, about expectations, saying no when the answer is no. I think oftentimes we feel like we shouldn't say no, or that it's going to hamper the relationship building process, or so distressed to say no or let somebody down, right? It's disappointing to hear no. But the reality is that when we either say yes when we know something's not possible, or kind of hem and haw and say, you know, maybe I'll see and maybe I'll ask Ari and she'll have a different idea, you're giving folks a lack of clarity, which again, when there is trauma around inconsistency and lack of predictability, right, that false hope can translate into, yeah, she doesn't tell the truth. I can't trust her. Whereas if you just say, I'm really sorry, we can't do that, at least you're being honest and consistent. And that means that when you do say yes, that yes is that much more trustworthy and reliable. treating others with dignity and respect. I think that's a rule across the board. We should treat everybody, whether we work with them or for them or know them in our personal lives. Being aware of our biases. I had a coworker who was in recovery, was raised by folks, by parents who abused alcohol. And so she had a really difficult time being around people who were drunk specifically. Under the influence of other drugs was fine for her, but there was something around alcohol that for her was really, really difficult. And she had an immediate bias. Being aware of that can be really, really important, because whether we're conscious of it or not, those biases automatically trigger certain associations we make with the behaviors people bring up. And so rather than thinking about, okay, someone might be reacting this way because of all of these things that may have happened to them that I don't even know about, we're immediately making our own associations. And the flip side of that can be true as well. Like, I don't really have a problem with people yelling. I come from a culture where raised voices is not a sign of aggression. It's a sign of passion, or like, that's just how we talk to each other. That's my dinner table, is raised voices. And so I had to learn to be aware that a raised voice can be triggering for another person in a way that it's not for me. That can be received to someone else as, I'm in danger, someone's mad at me. Whereas for me, it's like, oh, we're just having a conversation, right? So biases can go in a variety of different directions. They're not just negative. Just being aware of where the culture you come from, the experiences that you've had shape the way that you experience various behaviors and situations. Asking before doing, maintaining boundaries, that's shown up a lot in the chat as well, around consent, asking questions, this idea of going to the doctor and having the doctor explain what they're going to do ahead of time, right? That's really about leading with consent. Yeah, Aisha, quiet can be triggering too. Same as yelling, and that's not, silence is not like an inherently loaded experience, right? It's highly personalized and it's individual for various people. Yeah, silence was a sign of anger growing up, Stephanie, for me as well. So like, yelling for me, I'm all good. Once things go quiet, that's when I start to get nervous that someone's gonna pop off. So it really is just, it's dependent on your individual experience, and building that relationship with the folks that you work with through trustworthiness and transparency is how you start to understand those individual triggers. So moving forward now, we're going to come back to Jay, and I want to ask you all, in a little scenario, you are kind of facilitating a warm handoff with Jay and a mental health service provider. You know that Jay has trust issues, you know that he can get shut off, and that there's some potential safety concerns there. So what are some things that you would do in this moment, in this interaction, or ahead of time prior to this interaction, to help set up Jay for success and build some transparency and trustworthiness into this warm handoff? Explain the purpose. 100%, Aisha. That's so important. It can be so disorienting to just have another person now be here asking you all these really personal questions and not knowing why. Maybe talk to the provider ahead of time to understand his triggers and boundaries. It's a great idea. Letting Jay know what to expect ahead of time. Absolutely, yes. Detailed prepared notes about what approaches have worked best in your experience. Definitely. Integrity, follow up, and follow through. Yes, it's going back to that consistency, that reliability, setting realistic expectations. Yes, I love this. You guys definitely got this this trauma-informed principle down. So we can move ahead to peer support, which is our next principle. someone brought up earlier in the chat that a protective factor to trauma is talking to someone else who has been through it. And that's something that can be not only a protective factor um, after the fact, or sorry, a protective factor before the fact, right? So building resilience to future trauma, it can also be something that really facilitates healing after the fact. And so having your lived experience believed and validated and affirmed by someone who themselves has been there just feels different than having someone who does not share that experience listen and validate. It's not more or less important for someone with a different lived experience to give that validation. It's just different, and there's a special role for peer support to play in the facilitation of a trauma informed approach. People who can share narratives of their journey and of their healing with folks who are earlier on in that process um, can give hope and can give opportunity and kind of empowerment around what is possible in the movement towards the goals that folks are setting. Um, Marvell says it works for sure in our men's wellness group sessions. Yeah, absolutely. So peer support can mean a variety of different things. We can have peer recovery counselors and paid peer support staff on your team. There can also be tenants councils, men's wellness groups, parenting groups, tenants leadership groups, lots of different ways. We have AA, NA, lots of different opportunities for peers to come together and lift each other up um, on the pathway towards resilience building and healing from trauma. Moving ahead now to our fourth principle. I guess before I move on, though, I am curious if folks have other examples. The men's wellness group, I love that example. Do y'all have other kind of thoughts or examples of the way peer support shows up in your programs? And like I said, it can take a variety of different um, advocacy. Yeah. Yeah, we can have tenants councils or various groups that provide advocacy together as peers. Peer support reinforces the idea that homelessness is an experience and not an identifying characteristic. Absolutely. Definitely. It builds community. Yeah. Women's empowerment groups. Oh, I love coffee hour. Yes. Posing questions that are about experiences to explore ways to increase peer support and community. It's so important to have opportunities to just socialize and be people together, not just, you know, these formal kind of organized fun or organized activities or therapeutic interventions, but also just coffee hour, a place to hang out and connect as a community. Definitely hiring on staff with lived experience who represent the community. That's crucial. Yeah, sharing experience, strength, and hope. I love that. Thank you all so much for sharing, and please continue to share in the chat. These are really awesome examples. I'm going to move us along. So the fourth principle is collaboration and mutuality. So I spoke to this a little bit before, the idea that everything you do should be in collaboration with the folks that you work with, because they're the experts in their own experience, and what happened to them is not the same as what their experience is of what happened and what the impact of what happened is on their bodies and on their the way that they kind of receive information from the world. So collaboration is about creating a dialogue regarding the differences in the identities and lived experiences between the two of you, recognizing that as a service provider, you hold a different amount of power than the person you work with. So even if you have a lot of shared experiences together, shared identities, shared lived experiences, the fact that you are the service provider and they are the client or recipient of services sets up a certain power dynamic that just it, that's inherently unequal, and it's not always unequal in service of the service provider, right? You have a lanyard that gives you access to the building that they may not. You have an email address and internal access to the organization that may give you proximity to decision making. You might know updates to policies and procedures sooner and be the one um, to communicate those decisions out. You may even impact some of those changes to policies and procedures. But recipients of services also have certain power. They are the ones who dictate what should be in their service plans. They're the ones who decide what their goals are. And I think also recognizing and helping them to recognize the empowered position and proximity to power that they have in their own journeys is equally important to that mutual and collaborative process. So it's recognizing the positional differences amongst both of you, and any unearned power and privilege. So you have all earned the privileges that come with your with the jobs that you're in, but we all carry various unearned powers and privileges based on where we were born and the various features of our bodies, right? The schools that we went to, the neighborhoods we grew up with, the the access to education our parents and grandparents had. All of these things add up. And put us in different positions, and that's true for the people we work with as well. And so just recognizing that and being able to have those conversations, and leading with that humility and curiosity. And that brings us to the next principle, which is all about empowerment. So again, really honoring, recognizing, and building upon the strengths and experiences of the folks that you work with, and recognizing and highlighting for them the critical role that they play in their own lives. Right, they are the agents, and they are the decision makers in their own lives. Going back to that trustworthiness and boundary setting, there is a container, there are rules. If their names are on a lease, there are certain rules and responsibilities that come with that lease. If you have service agreements, if you help with employment connections or benefits connections, there are certain boundaries with which we all have to act within, but helping recognize where there are opportunities for decision making. Back to that example of that doctor's appointment, many of you spoke to having the opportunity to ask questions, having the doctor spell out what's going to happen so that you can pinpoint where you might want to go in a different route, or ask the doctor to clarify what other options are available. Those are all the same things that we can do with the folks that we work with, and supporting that shared decision-making process. This also goes back to that idea that, again, trauma is unique. The person that you work with knows their triggers best. They also know their strengths and their resilience and what will support their healing journey the best. And so really being able to tap into those strengths and resources, and lift those up. Do folks have examples of ways in which you've kind of brought in voice and choice for the folks that you work with? Sometimes it can be as simple as asking someone how they'd like to be referred to. When I first met Ari, I asked, is it Ariana? Is it Ari? You can ask, would you like to be referred to as Miss Saunders, Mrs. Saunders? Some people prefer that too. Even just that question shows that you are recognizing the dignity of the person and giving them a choice in how they're going to be referred to. Providing translation services so they can tell their story in a language that is most comfortable for them. That's a great example. It can be really difficult and cumbersome to try to communicate in a language that's not it's not um, a primary language. Asking their housing goals, yeah, giving choices in housing, not assuming that you know what's best for them or know what their goals should or could be. Um, Yeah, absolutely. Some folks like to be referred to by first name or even a nickname. Yeah, or a chosen name. Some folks have a different name than what is on their birth certificate or their driver's license. And so asking what they'd like to be referred to can also lead to a conversation around goals. Maybe a goal is changing their legal name to be more aligned with the name that they go by. Um, that's that's a really great example. Thank you. Anyone else? We have one more principle we're going to get to. Asking what time works best to meet. That I love that you brought that up. I think so often we can unintentionally mimic some of these really difficult systems and structures and institutions to move through that folks have been traumatized by, and a lot of times that kind of institutional trauma comes from very, very rigid hierarchies and structures that are really difficult to navigate. If you have an appointment at the SSI office at 10 a.m. And you're unsheltered and you don't have money for the bus, it can be really impossible, frankly, to get there by 10 a.m. And then you lose your appointment and you can't find another one. And that entire process can be incredibly demoralizing and traumatizing for some folks. And so the simple act of asking them what time works for you to meet, what place would you like to meet? Would you like me to come to you? Would you like to come to my office? Would you like to meet somewhere else? These are all little opportunities that might seem small, but can have an immense impact in restoring dignity and really showing with your actions that you are centering the voices and choices of the folks that you're working with. So thank you, Jamila. That's a great example. Okay, I'm going to move us on to the last and final principle, culture, identity, and history. So I've talked a little bit about this. The way that we're brought up and the backgrounds that we come from shape the way that we see the world and the way that the world interacts with us. Um, and that includes the traumatic experiences that folks have. It also includes the resources and definitions of healing that they have. And so seeking to understand and honor those cultural differences with the folks that you work with, that includes clients, coworkers, staff, supervisors. We all have different ways of defining what is traumatic and what is resilience building and what is healing. And so this is equally true for the tenants and the clients that you work with, but also with your coworkers when thinking about vicarious trauma or how to respond as an effective team member or supervisor after a really difficult experience has occurred. Sometimes those those resources for healing and resilience building are deeply cultural, and it might not even be something that you think of because it's not within your culture. There's also generational and historical trauma that happens within certain communities that can be passed down from generation to generation. And so it's not only about what has happened to the person in front of you, but also what their family and their ancestors have been through that they carry with them. We can think about things like slavery, the Holocaust, colonization. These are things that, the tenant in front of you may not have experienced directly, but if they come from a family that was impacted by these historical traumas, that still may show up and may be activated by certain triggers that are just important to be mindful of. So again, important to check assumptions and biases and recognize that um, there are certain behaviors or emotional responses that may seem confusing to you that are really just cultural. I worked with a woman once who refused to let me into her home, and I thought we had a really good relationship. Like, I didn't understand why she wouldn't let me into her home. And eventually I realized it was because she was raised to host. Like, it is impolite. If you are inviting someone into your home, you have to make sure you have refreshments, you have to have food, you have to have a clean house, you have a place for them to sit. And she didn't have those things. And so if she wasn't prepared to host, I couldn't come inside. Like, it would be disrespectful of her to let me into her home if she was not able to offer me a freshly prepared meal and something to drink and have a place for me to sit. And so what I thought was a barrier of, maybe something happened and I broke her trust or something like this was really just something that was culturally ingrained in her. And it was a way that she was trying to maintain the relationship with me, actually. She was trying to maintain respect in the dynamic with me by not inviting me into her home without being able to host properly. Whereas that didn't occur to me. I'll have someone over even if I don't have a full meal prepared for them, I wasn't raised that way. So it just takes time to get to know folks. And while you do so, continuing to just recognize we all come with assumptions and biases and knowing, learning to kind of to have that self-awareness to know when they're showing up. So I'm going to wrap us up with the next slide here. I want to kind of summarize us here today with 3 critical moves for being trauma informed. These are pretty similar to how we address triggers. So firstly, we want to think about reducing the harm of ongoing trauma. Wherever possible, we want to eliminate or reduce the impact of the traumatic experience that might be ongoing or still occurring, or that might be activated or triggered by an environmental factor. And I think in the work that many of you all do, the clearest example is by helping somebody exit the very traumatic experience of homelessness, you're already kind of taking that first step to reduce the ongoing trauma of being unhoused. Secondly, we want to help build resilience. So, like we've been saying, we can't go back and undo the past. We also can't go into the future and prevent any further harm from occurring, but we can help build resilience so that little by little they can be less impacted by trauma and by triggers of previous trauma. And a lot of the work that you all do is essentially building resilience, whether that's helping with supportive services or with employment connections, education connections, helping build community and foster that sense of belonging. These are all really critical factors in resilience building. And then lastly, reducing the likelihood of re-traumatization. We can't provide an environment that will ensure no one ever has a trigger in any way at any time. One, because as Ari said, you have to go out and interact with the world. You have to go to a waiting room sometimes if you have a doctor's appointment. But the other piece here is that triggers change. And sometimes folks may be fine going into a waiting room, and other times, because of other factors that have come up recently, that traumatic memory is more present. And so being in a waiting room is suddenly a lot more activating than it was last week. And so being responsive and mindful to that means being respectful, being communicative, building that trust, and honoring the voice and choice and dignity of the people you're working with, to remind them that they have a say in how they interact with you and with the world around them, and helping to kind of reinforce that wherever possible. So I do want to call out the form that Jamie dropped in the chat. There is a short survey that's in there before folks hop off. But we do have a few more minutes for questions if anybody has anything they'd like to ask or to share. If you have anything to kind of expand upon what's been shared in the last little bit we've had together.
Yeah, any aha moments that have happened?
I'm not seeing any hands up, but I think folks can also unmute if you have a question you want to ask out loud. Just a quick reminder that we're gonna share the recording and also the training materials. So it won't be the slide deck, but there's some training support materials that'll come out. And again, want to ask folks just to do a quick, take a minute to fill out the survey. But we can hang out here. We still have 12 minutes left. If you have questions that you might want to ask them. Or of each other.
Absolutely. Yeah. Thank you all. I know I could tell by the chat, people coming and returning, that you all are very busy. So thanks for taking the time and engaging with us. It was very good.
And I'll say, if you all think of questions that come up later, you can always write them to I'm going to put our email in, Contra Costa CoC, and we can reach out and get some answers. Great. You guys are getting big love in the training. I mean, in the chat.
Thank you.
Love it. We'll hang out here, but we release you. We're officially done. But we'll hang out a little bit in case anybody wants to stay back and ask any questions. Thank you all.
Yeah.
If you're going to hang out here, we're going to assume you have questions.
Yeah. All right.
You're welcome to hang out here.
I can stop sharing too so folks can see.
Thanks, you all. Well, you might get 10 minutes of your life back.
Right.
Okay, people were doing the survey. Oh, this has been a very safe space. Good job, team.
Oh, awesome.
Great. All right, I'll stop recording.